Xarelto, Rivaroxaban. Introduction. All blood clots are harmful.
Select true or false.
Correct. Blood clots are helpful when they form to stop bleeding. Blood clots which are unrelated to injury can be harmful when they form and move inside the blood vessels, interrupting blood flow. When the blood is too thin, it is more likely that a blood clot will form inside the blood vessels and heart.
Select true or false.
Correct. If the blood is too thin, it is less likely for a blood clot to form, but more likely for excessive bleeding to happen. You are about to take your daily dose of Xarelto, but then you remember that you did not take it yesterday. You missed yesterday's dose. Should you take 2 doses of Xarelto now to make up for the missed dose? Select yes or no. Correct. Stay on your once daily schedule. Do not take extra medicine the next day to make up for your missed dose of Xarelto. Patients taking Xarelto do not have to check with their healthcare provider when taking over-the-counter medication.
Select true or false.
Correct. Other medicines can drastically affect how thin the blood is. That is why you should check with your pharmacist or healthcare provider before taking any medication, including prescription, over-the-counter, vitamin, and herbal products. Advil is a non-steroidal anti-inflammatory drug. If you take Xarelto, should you use Advil to relieve muscle pain without the approval of your healthcare provider? Select yes or no. Correct. Advil is a non-steroidal anti-inflammatory drug that also affects blood clotting. These types of drugs should not be used with Xarelto without your healthcare provider's approval. Internal bleeding is more likely when the blood is thinner than it should be.
Select true or false.
Correct. Internal bleeding is more likely when the blood is too thin. If you see signs of internal bleeding, such as dark urine or stools, inform your healthcare provider immediately. If you follow the exact prescription of your healthcare provider, it is impossible for internal bleeding to happen. Select true or false. Correct. Internal bleeding can happen even if you follow the prescribed dosage. This is why it is important to tell your healthcare provider if you notice any signs of internal bleeding. Minor bruises are a normal side effect and do not require that you call your healthcare provider.
Select true or false.
Correct. Minor bruises are normal and do not require medical attention, but large areas of bruising or unusual bruising are not normal. You should call your healthcare provider if you have large areas of bruising or unusual bruising. Thank you for using Explain.